Hello and welcome to this tutorial on the thoracic cage and vertebral column. In this particular tutorial I want to cover the bones of the thoracic cage and I want to cover the vertebral column bones and their bony landmarks. So we'll go ahead and start with the sternum. The sternum is a bone made of three parts that's located in the anterior portion of the body. As you can see in this picture, it's made of three portions. We'll cover each one of those in a separate slide. A couple of features associated with the sternum that have medical significance would be the suprasternal notch, located here at the arrow, and also the sternal angle. We'll cover these later on in different parts of anatomy and physiology. So the sternum is made of three parts. The top portion, or smaller bone there, located right there where the arrow is pointing, is called the manubrium. We then have the sternal body, or the body, and then we have the xiphoid process. The xiphoid process is an interesting part to learn because in CPR, if you press on that particular bone, it can detach and lacerate organs that are underneath. Those organs would include several things, such as let me get my laser pointer, such as the liver. So we have the liver right there. You can see where the xiphoid process is. If that breaks off, you can cause liver hemorrhage and even death. And you can see that here the diaphragm, which is the muscle that aids us in breathing, can be torn if that xiphoid process is broken off in an incorrect CPR technique. So the ribs, we have 12 pairs of ribs. These are the structures that are located all along the side of the thoracic cage right here. Notice that the rib bones don't directly connect into the sternum, but they have a costal cartilage made of hyaline cartilage that's going to attach them into the sternum. During CPR, oftentimes you can hear cracking because that's basically cracking the attachments of the cartilage to the sternum. So we do have 7 pairs. So you can see pointing to by the arrows are the 7 pairs of true ribs. True ribs are called true ribs because they have a direct connection. The rib bone has a direct connection into one of the parts of the sternum. So if you have a direct connection, you're considered a true rib. False ribs, we have 5 pairs of false ribs. The false ribs, the first 3 pairs of false ribs up here, they're considered false ribs because they each connect in together and then they have a connection into the sternum. They don't have their own direct connection, so therefore they're considered to be false ribs. The last 2 pairs of false ribs don't even connect to the sternum, and they have a special designated name called floating ribs. And they're not floating around, they are anchored and connected, but they do not have a direct connection into the sternum. So when you go to study these bones, it's really important that after watching the tutorial, you stop the video and then go through and try to remember all the bones and parts that you've just learned. So it's always really important to do repetition in your study and to quiz yourself without looking at words. Next, we'll go ahead and talk about the vertebral column. The vertebral column, from at least a lateral view, you can see it kind of like has these little S-curves in it. We do have the cervical curve, the thoracic curve, the lumbar curve, and then the sacral curvature as well. These curvatures give our body flexibility, our vertebral column flexibility when we're walking. So the first 7 vertebrae are called cervical vertebrae, so you can see them listed up here. And so the first cervical vertebrae would be C1, second would be C2, etc. Cervical means neck. A cervical collar is that device that you put around a person that has a neck injury to immobilize the neck region, to decrease the potential for spinal cord injury. So the first 7 vertebrae are called cervical vertebrae. The next 12 vertebrae are going to be called lumbar vertebrae. So again, thoracic vertebrae. So the first thoracic vertebra is going to be called T1, and then we have T2, T3, etc., all the way through the 12 thoracic vertebrae. And these are found in your thoracic region. That's why they're called thoracic vertebrae. We then have the lumbar vertebrae. Lumbar vertebrae are the last 5 vertebrae. So you have lumbar vertebra 1, 2, 3, 4, and 5. So these are the making up kind of your lower back. That's the lumbar region or your lower back region. Part of the vertebral column we have at the very end is the sacrum, and then we have the coccyx bone or your tailbone. So as is our habit, we need to stop and we need to review those vertebrae without looking at words so that we always are making sure we practice and have repetition. Alright, so next I want to cover the parts of one vertebrae. And so this is a vertebra that is shown in transverse section. So basically you're looking at it from a top view. And this back process is called the spinous process. The vertebrae are going to have all these different processes and parts coming off, and these are going to serve for attachment points for muscles. So this is the spinous process. Next, and you can see in this particular drawing from a side view or from a lateral view, you can see that these spinous processes stick off the back. And if you were to run your finger along the back of your spine, you would be able to, the center of your back of your spine, you would be able to feel the spinous processes. All right, again, from this particular vantage point, there are these processes that come off on the sides, and these are called transverse processes. Through the transverse process of the cervical vertebrae, you're going to have these little holes here, and these are going to be called transverse foramen. Okay, so there's one there and one there. And the job of the transverse foramen is to serve as a passageway for the vertebral artery. So the vertebral artery is going to pass through cervical vertebra 6, 5, 4, 3, 2, and 1 as it's heading towards the brain. So this is going to be a major artery that's going to feed the brain, and it has to go through that vertebral foramen. All right, so the kind of the bulky main process here is going to be called the vertebral body. So this is the body of the vertebra, and it supports the weight of the body. So as you go down the vertebral column, these vertebral bodies get bigger and bigger as they have to support more and more of the body's weight. This main hole that you can see here in the middle of the vertebra is going to be the vertebral foramen. And the vertebral foramen is going to house the spinal cord. So that's what the spinal cord travels through as it goes out of the brain and down through the vertebrae. All right, to kind of like summarize some of the things we've looked at and maybe even introduce a couple of more concepts, we have the vertebral column here in a side view or a lateral view. And to review, we have the spinous processes. Okay, so each one of these is a spinous process. We have coming towards you the transverse process. We have the vertebral bodies. The vertebral bodies don't sit on one another directly, but there's an intervertebral disc, a little disc of fiber cartilage that cushions the vertebrae so that they don't touch each other and cause severe pain and suffering and grind the bone to pieces. You can see the vertebral foramen with the spinal cord going through it. And the spinal cord has pairs of nerves that are going to exit and innervate the body to serve the body. And the spinal nerves are going to exit the vertebral column via this structure called the intervertebral foramen. So there is a hole there that is made between the two vertebrae, and we're going to have the spinal nerves that are going to come out from that. Of course, if you grow little extra bone spurs, or if these intervertebral foramen collapse, you can get nerves that get pinched coming out of the intervertebral foramen, and that can be a real problem, especially later in life. So as our usual habit, stop the video, practice the parts that you just learned. Repetition and practice is a really good way to learn the bones and the parts of the bones. Okay, our last two bones of the vertebral column would include the sacrum and the coccyx. So the sacrum is this particular bone outlined by this bracket, and then the coccyx bone is below that or inferior to the sacrum. Now in these next pictures I'm going to have an anterior view, so a view from the front, and then I'm going to have a posterior view or a view from the back side. And you can see they do look different. They have different structures that you can see in those different orientations. Alright, so we'll start with the sacrum and name some of the bony landmarks. So we do have the sacral canal. Okay, the sacral canal is this hole that goes, it's the top of the entrance or entrance into a hole that goes through the sacrum. So that's called the sacral canal. We next have the sacral hiatus, which is the exit of the hole that goes through the sacrum. There are also holes that you can see in the anterior and the posterior view through the sacrum, and those are called sacral foramen. Okay, now I'm going to take and show you a picture of the spinal cord and show you why we have a sacral canal, a sacral hiatus, and sacral foramen. So here's your spinal cord right here. Here's where it's ending, and then we have this thing called the cauda equina, which are these nerve processes that come out from the end of the spinal cord. These nerve processes, you can see some of them are going to exit through the intervertebral foramen between the vertebrae. Here they have taken away the vertebrae so that you can't see the vertebrae now, but you can just see the spinal cord that going through the vertebral foramen. So here you can see that parts of these nerves, these cauda equina that comes out, parts of these spinal nerves are going to be coming through the sacral canal, and they will exit through the sacral hiatus. And they're going to make up some of the sacral nerves and the coccygeal nerves that will come out and innervate the tail end of your body. Notice that some of these nerves that are coming out are going to go through the sacral foramen, and then they'll innervate the front part of your body. So this is the posterior view of the sacrum. And so these nerves are going through the posterior sacral foramen and coming out the anterior side to innervate different parts of the body. So the reason we have a sacral canal and sacral foramen in the sacral hiatus is they serve as passageways through nerves that are coming out of the spinal cord. Okay, so here we have the median sacral crest, which can only be seen in the posterior view. So this is going to serve as an attachment point for certain musculature. So this whole thing is the median sacral crest of the sacrum. And lastly, we have the coccyx bone, which is at the very end of the sacrum. So it's inferior to the sacrum. And some people have extra vertebrae here or extra sections of this, and they'll have a longer coccyx area. Some people actually have to have it removed because it literally is a little tail that has to be removed, surgically removed. And as our usual practice, you always want to stop the video, practice all the parts that you just learned, because review and practice is a way that you learn these bones.